Everybody, welcome back to UWorld's Next Gen NCLEX review session. My name is Jackie and I'm a nurse here at UWorld. We're so glad to be back with you guys again this week after our little Thanksgiving break last week. We are going to be doing an infection question drill today. So if you guys are new to these question drill sets, what you can expect is we will pull up a question, we'll read it to you guys, give you about 30 seconds to answer, and then we will walk through why the correct answer is right. So make sure you guys use the chat. We have Nurse Samantha moderating for us today. She can help answer any questions you guys might have, but we hope this will be helpful for you guys. And with that being said, let's go ahead and get started. All right, question number 1. The nurse in the emergency department has collected information about clients waiting to be seen. The nurse should first assess the client who has option 1, epistaxis and takes aspirin, option 2, dysuria and takes tamsulosin, option 3, vomiting and reports frequent loose stools, option 4, persistent cough and reports night sweats. All right, let's see. Drop those answers in the chat. And welcome to some of our first-time viewers, one of our viewers on YouTube. We're glad to have you here. Welcome to the UWorld nursing community. We love to welcome new people in. And with that being said, make sure you guys share this session. Invite a friend, let them know that we're on live today. We're covering all sorts of different infectious disease processes. So let us know, or, invite a friend, follow us, all the things. All right, I'll give y'all about 10 more seconds to answer, and then we will pull up the correct answer. So good work, you guys. Awesome job. All right. So our correct answer on this one is going to be option 4, persistent cough and reports night sweats. Okay, so starting with this question, we see the word first bolded. So this is going to indicate this is a priority question. Typically what we would say is you can prioritize based on ABC, so airway, breathing, circulation. But then after that, you're going to incorporate infection, then safety. And that's kind of really where we fall in this prioritization cascade. Everybody essentially seems relatively stable. We're not seeing anything that's like super alarming or anything like that. So we're going to really focus on that infection element to this question. So when we see persistent cough and reports night sweats, we're going to worry a little bit about tuberculosis. And we know tuberculosis is spread via airborne like particles. So we need to worry about safety. So we need this client to be in a negative pressure room. And as a nurse caring for this client, we need to wear an N95 respirator to protect ourselves and then protect the other clients that we're caring for. So that's kind of where we fall with this one. What we see on option 1, epistaxis and taking aspirin, that would just be like a bloody nose. And we know aspirin is an antiplatelet medication. So those kind of things, we're going to want to monitor it, but it's not anything life-threatening and no one else is kind of at risk in this situation. Option 2, dysuria and takes tamsulosin. Tamsulosin is a medication that we give for BPH or benign prostatic hyperplasia. We would want to rule out a UTI, but as of now, we can't confirm that this is infection. It can also just be a symptom of BPH. And then vomiting and reports frequent stools. This sounds a little bit like some gastritis, maybe food poisoning. So again, our immediate need to address is our client that has probable tuberculosis, protecting ourselves, protecting the client, and protecting other clients. So good job, you guys. All right. Option 2, question 2. The nurse is preparing to administer vaccines to assigned clients with HIV infection. Which of the following vaccines should the nurse hold for clarification prior to administering? Option 1, pneumococcal conjugate vaccine. Option 2, human papillomavirus vaccine. Option 3, hepatitis A vaccine. Option 4, varicella vaccine. All right, I'll give y'all 30 seconds on the clock. Drop those answers in the chat. Let us know what you guys think. And let us know, too, when you guys are taking your NCLEX. We would love to wish you good luck. And if anyone on here just passed your NCLEX, let us know, too. We'd love to celebrate you. We also have on our website, uworldnursing.com, a way that you can share your story about kind of like your journey to becoming an RN or anything that was helpful for you. And if UWorld was part of that journey, we want to celebrate you guys. So let us know. All right, we have someone on TikTok testing in January. Nina on TikTok, you used UWorld, and you got your test results and you passed. That's amazing. This is like the best part of our day. So we're so happy for you. So excited for all the good to come in your nursing career. Esme, good job. Good work, you guys. Shelly Ann, testing on December 11th. Good luck, you guys. That's awesome. All right, so our correct answer on this one is going to be option 4, varicella vaccine. Okay, so when we're talking about a client with HIV, let's start with the question. So clarification. So we are looking for the option choice, or the the option that's going to make us question, like something doesn't seem right. This doesn't kind of track with what we're dealing with. So a client with HIV infection, they are going to have their CD4 cells are going to be destroyed. So CD4s are like an integral part in our immune response. So if we have a low CD4 count, we're going to have a low kind of attack to pathogens. And so the varicella vaccine is a live vaccine. So we're not going to want to give that to a client that has a low immune system. We don't want to generate any type of immune response that the body can't fight off. So the other options 1, 2, and 3, those are not live vaccines, and those would be appropriate for this client. All right, good job, you guys. Question 3, the nurse is caring for a client with hepatitis C. Which of the following actions should the nurse take? Select all that apply. So we're going to have more than one right answer. Option 1, instruct housekeeping staff to use bleach products to clean surfaces in the client's room. Option 2, monitor the client's laboratory test results for prolonged PT and activated PTT. Instruct the client to use protection when engaging in intercourse. Option 4, request a prescription for lactulose for the client. Option 5, monitor the client for jaundice. All right, 30 seconds on the clock. Drop those answers in the chat. Let us know what you guys think. Let's see. I know I missed a few other people. Good luck to our tester. Another person testing on December 11th in North Carolina. Good luck. Good luck. That's awesome. Someone's asking about let's see here. Our proctors. Well, good work, you guys. Sorry, I was trying to get caught up on the chat. A lot of chats coming through. But you guys are doing great. I love seeing all these answers. You guys, a lot of 3s and 5s, a little bit of mix on 1, 3, and 5 versus 2, 3, and 5. So good work, you guys. All right, and good luck to Danielle, who's testing December 20th. Okay, our correct answer on this one is going to be options 2, 3, and 5. So when we talk about this question, we're just looking in general for what we would include in the client's plan of care. So hepatitis C is a blood-borne pathogen. It's going to infect the liver. So some of the common causes for this can be like needle sharing with an infected needle, needlestick injuries in healthcare workers, and any other encounter with infected blood, like contaminated blood, which is really very rare, tattoo equipment, anything like that. So since this virus infects the liver, we're going to worry about liver function, and we're going to want to monitor that in these clients. So we need to monitor things like PT and PTT, which indicate our clotting time. So these are, again, an indicator of our liver function. So we want to make sure that we're clotting, producing those clot factors the way we need to. We also need to teach about using protection, as this hepatitis C can be transmitted through intercourse. And then also jaundice is an indicator of liver failure, so we want to monitor for that, for disease progression. What we see in option 1, this is more associated with what we'd see with C. diff. And then option 4, requesting a prescription for lactulose. Lactulose is going to help clear ammonia from our blood. It's not going to really help do anything with our liver function. It's kind of helping to manage a symptom of liver failure. So good work, you guys. You did great. All right. And I saw someone said lactulose is for hepatic encephalopathy, and that's very true. Okay. Question 4. The nurse is screening clients for those at risk for developing influenza. Which of the following findings should the nurse recognize as a risk factor for influenza? Select all that apply. Option 1, consumes a plant-based diet. Option 2, history of type 2 diabetes mellitus. Option 3, resides in a long-term care facility. Option 4, receives hemodialysis 3 times per week. Option 5, takes methotrexate for rheumatoid arthritis. All right, 30 seconds on the clock. Drop those answers in the chat. Well done, well done. Good work, you guys. And let us know too if you guys joined us yesterday. We had a great live on ABGs, and I know that is a tricky topic for a lot of you, so you can check it out on demand on all of our channels. And then we will do another question drill set tomorrow, so be sure and come back tomorrow at 3 p.m. and we will be covering developmental milestones, another tricky subject as well. All right, good work, you guys. Okay, so our correct answers on this one, there's a lot of them, are going to be 2, 3, 4, and 5. So when we're talking about influenza, again, we're looking at risk factors. This is pretty straightforward, but with a select all that apply question, we are going to take like a true false approach to these options. So like, yes, this is a risk factor. No, this is not. So when we're talking about influenza, we can contract it in a lot of ways, but one of the biggest or kind of the biggest risk factors are going to be our clients who are immunocompromised, and then our clients that are around, like in close proximity to a lot of other clients. So that's really what we're seeing here. So if a client with type 2 diabetes, they're going to have a little bit of being a little immunocompromised. They're going to have a higher chance of responding to infection and having a greater kind of burden on their immune system if they do contract a pathogen or an infection. Option 3, with a long-term care facility, these clients are in close contact with a lot of people, kind of intermingling germs like we wouldn't anticipate happens in a classroom, like in school, kind of the same idea with this. And then option 4, hemodialysis, is kind of a combination of both. So these clients can have a little bit of being a little immunocompromised due to kind of our kidney function being down, our blood's not being able to be filtered quite as easily, but also being in close proximity to others. And then methotrexate for RA, this is a immunosuppressant medication. So it's going to lower our immune system to help manage those symptoms of RA. Plant-based diet, that's not really going to do anything. It's not going to increase our risk factor for the flu. Probably would be good. You'd probably get a lot of good vitamins and nutrients to help fight some infection. All right, good job, you guys. Okay, question 5, past halfway. Okay, the nurse in the urgent care clinic has taught a client with newly diagnosed streptococcal pharyngitis. Which of the following statements by the client would indicate a correct understanding of the teaching? Select all that apply. Option 1, I plan to place a humidifier in my bedroom. Option 2, I should contact the clinic if my urine color changes. Option 3, I will receive a prescription for an antiviral medication. Option 4, drinking cool citrus juices will be soothing to my throat. Option 5, gargling with a warm saltwater mixture may alleviate my pain. All right, 30 seconds on the clock. Drop those answers in the chat. Oh, I love seeing we have someone graduating soon. Yes, we are at the tail end of like the fall semester. So let us know too if you guys are almost done with nursing school. Like, what an accomplishment. I'm sure you're in your home stretch of clinicals, getting ready for exams, starting your NCLEX studying. We have tons of great resources for you guys on uworldnursing.com. So check that out. And you've got an exciting 2025 ahead of you if you're getting ready to graduate. So very good, very good. All right, good work, you guys. Oh, we got a lot of graduates. That's awesome. Okay, good job. Okay, so our correct answers are options 1, 2, and 5. So we're just talking about strep throat. Again, we're talking about correct understanding of teaching. So when we see like effective teaching questions, we want to see what the question's asking us and then kind of answer true false to that. So if this is what a client is saying, is that appropriate understanding? If this is what a nurse is saying, are they saying the right things? So you can kind of look at it through that lens. But with strep throat, we're kind of focused on comfort measures and then also giving medications. So a humidifier can help alleviate some of that pain in the throat. That's totally a correct intervention for strep throat. Option 2, this is definitely important teaching that we need to share with the client. So untreated strep throat can lead to acute post-streptococcal glomerulonephritis, which is essentially a strep infection in our kidneys. One of the hallmark findings of that is going to be cola-colored or tea-colored urine. And so we definitely want to make that client aware that if this happens, they immediately need to let the healthcare provider know and they need additional treatment. And then gargling warm salt water, that's definitely going to be a comfort measure. The salt water is not only going to help kind of reduce that swelling, but it's going to alleviate some of that pain. So it's kind of like an osmosis happening at pools. some of that fluid and that swelling from our throat out through the salt, like kind of the hypertonic solution, and it really does provide a lot of relief to these clients. Cool citrus juices, not going to be good. That sounds painful just talking about it. We don't want to have anything really acidic going on our already inflamed throat. And then strep throat is a bacterial infection, so we're not going to give an antiviral for this. A lot of times we'll give medications like amoxicillin. So good work, you guys. All right, question 6. The nurse in the emergency department experiences a needle stick injury while caring for a client with hepatitis C. Which of the following actions would be a priority for the nurse to take? Option 1, notify the healthcare provider. Option 2, begin taking post-exposure prophylactic medications. Option 3, scrub the site with an alcohol swab. Option 4, allow a staff member to collect a blood specimen for baseline testing. All right, 30 seconds on the clock. Drop those answers in the chat. Let us know what you guys think. Good job, you guys. Good work, good work. Awesome. I see a lot of people wondering when's a good time to start. We always say 60 days out. But you honestly can never start too soon. There's a lot of information to cover for the NCLEX, and so you can never start soon enough. But all of nursing school is kind of like your prep for the NCLEX. So you guys will do great. Good work, you guys. All right, I will give y'all about 10 more seconds, and then we'll pull up the right answer. I'm seeing a good mix of answers on this one, so we will go through this one with a little bit more. Awesome. A little more explanation. Okay, our correct answer on this one is going to be option 4, allow a staff member to collect a blood specimen for baseline testing. So we kind of talked a little bit about hepatitis C already. It's a blood-borne pathogen, but in the event of a needle stick injury, the first thing the staff member needs to do is to wash the site with soap and water to flush out the site, and then they're going to notify occupational or employee health, depending on what it's called in the facility, and then they're going to collect a blood sample to monitor for hepatitis C RNA. So that essentially is that virus replicating in our body, and then repeat testing. So that's going to be the first thing we're going to do is option 4. So first things first, wash the site, call occupational health, and then collect a specimen, see if that pathogen actually transferred to the client. What we see in option 1, the healthcare provider, it's kind of like a distractor, probably important for them to know, but in this situation, it's not there's nothing that's going to come from notifying the healthcare provider. We need to take action to monitor for the progression of infection. Option 2, begin taking post-exposure prophylactic medications. That's not the case with hepatitis C. We monitor for the presence of hepatitis C RNA first, and then scrub the site with alcohol. Again, we talked about this. Use soap and water. All right, good work, you guys. Okay, question 7. The charge nurse is reviewing client care assignments for the next shift. The charge nurse should intervene if a nurse who is pregnant is assigned to care for a client with option 1, cytomegalovirus infection who is receiving ganciclovir. Option 2, sepsis who is receiving IV vancomycin. Option 3, myasthenia gravis who is receiving IV immune globulin. Option 4, cirrhosis who is receiving lactulose therapy. Well done. Good work, you guys. Awesome. Good answers. All right, if you guys have answered this one, you can get a bonus point and let us know what is the mnemonic for why this correct answer is correct, if that helps. Okay, good job. I see some people starting to put it in the chat, so good work, you guys. Good job, Amelia on TikTok. Good answers coming through. All right. So our correct answer on this one is going to be option 1, cytomegalovirus infection who is receiving ganciclovir. So pregnant nurses have to follow a lot of specific guidelines to prevent transmission of pathogens that can be harmful during pregnancy. And so CMV is one of those. So that's part of what we call torch infections. So that stands for toxoplasmosis, other, which is like parvovirus, varicella zoster. Then R is rubella, C is cytomegalovirus, and then H is herpes simplex virus. So CMV is harmful to the fetus, and it can actually cause deafness. So other things pregnant nurses need to avoid are certain medications like ganciclovir. This would can be harmful to the fetus as well, and like chemotherapy as well. Even things like radiation. So these can cause any type of some fetal abnormalities. So again, if we see anything that falls under the category of torch infections, we want to assign care of that client to a non-pregnant nurse. Okay, so good job, you guys. Again, what we're seeing in options 2, 3, and 4, those are all safe conditions to be around for a pregnant nurse, and also safe medications to give. So you kind of have to do like a double check on this question to make sure that it's safe. So good work, you guys. Okay, last question. That was fast. Okay, the nurse is caring for a client with varicella who has open lesions. Which of the following infection control precautions should the nurse implement? Option 1, wipe down all surfaces with bleach before exiting the client's room. Option 2, place a client in a semi-private room with a client who has pertussis. Option 3, limit visits by the client's family members to 1 30-minute visit per shift. Option 4, put on a N95 respirator mask, protective gown, and clean gloves before entering the client's room. All right, good job, you guys. Drop those answers in the chat. 30 seconds. Let us know what you guys think. A lot of good answers coming in. Again, just a reminder, we'll be live again tomorrow at 3 p.m. Central Time. We're going to be going over developmental questions. And if you missed our live yesterday, we covered ABGs, or arterial blood gases, with Nurse Samantha. And we went through all different respiratory, metabolic, acidosis, alkalosis, and did about 3 practice questions. So if ABGs are tricky for you, or you're kind of in that home stretch of learning some of those more complicated things for all the graduate nurses, check it out. We hope we were able to kind of simplify a really challenging topic for you guys. So good work on that. And again, if you missed it, it's available on demand, so you can go check it out. All right, so our correct answer on this one, you guys did great, is option 4, put on an N95 respirator mask, protective gown, and clean gloves before entering the client's room. So again, when we are talking about this client, we're just talking in general about infection prevention or infection control measures. So varicella is the virus that causes chickenpox. When caring for a client that has chickenpox who has open lesions, the nurse needs to follow airborne precautions. So N95, but in addition, airborne plus contact precautions. So gown, gloves, and disposable equipment. So you guys did really great on that one. I hope that that was really helpful for you guys. What we see in options 1, 2, and 3, these are not going to be appropriate infection prevention measures. Bleach is going to be, again, something we're going to use for C. diff. We need the client to be in a private room. And then option 3, limit visits by the client's family member. That's not an appropriate action to take for this client. So you guys did great on that one. Again, be sure you guys come back tomorrow at 3 p.m. Central Time. We're going to be covering developmental milestones. As always, we hope you'll check us out at uworldnursing.com. We have tons of great resources available for you guys, including our free trial and subscription information, as well as our event calendars, so you won't miss any of our lives. But thanks again for joining. We'll see you next time. Bye.